So this recording will be available on YouTube. So if you need to hop on and off, if you need to duck out, and honestly, if we're satisfied with where you're at just by reviewing the heparin and the fusion flow rate type questions, then we can kind of be done. But this is your time, your hour. So if and then also just keep in mind, like, I'll be here this afternoon as well, or later this evening, I should say, this well, for 2:20, 2:30 from 5 to 6. And then I repeat this on Thursday, same times, 1:15 to 2:15, and then 5 to 6. So you have a couple times. Everything will be recorded as long as someone's here to have a conversation with. If you can't make it and you have a question or you want to see a particular problem worked out, just email me. And then even if no one shows up at a particular time, I can at least get those posted, or make a video for you showing how these are done. So heparin protocol and flow rates, that's what we'll focus on. And I'm actually going to focus on the flow rate conversions for heparin and insulin infusions. And then if you need to, again, see like just how to calculate your flow rates and calculate your drop rates, just let me know. We'll come back to that. But hopefully after I show you a few of these things, you should probably be set, because this is the new stuff. So one of the things they actually have you guys do is doing flow rates, but being more specific with heparin and insulin, and then going from a units per hour flow rate to a milliliters per hour flow rate. And so I will do some of those scenarios. Occasionally someone will tell me that they will see something like going from milliliters per hour to units per hour, and then I'll show you how to work that way backwards. So what I'm going to do is I'm going to just change up some of the variables on here. So let's say this is 500 milliliters, 20,000 units is probably fine. And then it's, let's just say 8,000 units per hour. So I'm changing up these numbers. That way, when you go to the OneDrive folder, the 24 fall nursing 22230 practice testing key will be a little bit different. I know I advertise key. Technically the key is not up to date because I keep changing the variables. So the way that this works is just being here live and seeing me do it, or just checking like what I've written in ink. And if there's ever a question, just again, email me and I'll get you some clarification. I should probably just drop the key part of it. All right. And then we'll do, let's just say 250. Okay. All right, we'll come back to something. So let's start with these two. So when you're doing these infusion rates and you're converting units per hour to milliliters per hour, basically you just need to know how to use dimensional analysis to get you from point A to point B. So what we're trying to do is we're trying to go from units per hour and we're trying to convert that to milliliters per hour. And the only way we can do that conversion is with the available medication we have. And what we have available is a 500 milliliter IV solution with 20,000 units there. So that's our IV bag, 500 milliliters, 20,000 units. We know that it's infusing at 8,000 units per hour, and I want to know what that is in milliliters per hour. So what I typically recommend with this, and you can set this up any variety of ways. Some people like to start with milliliters per hour and then kind of work their way backwards. I'm just going to show you like how I kind of take the information that we have. I start with what flow rate we're given. So 8,000 units per hour. All right. I'm looking for milliliters per hour. So what I need to do is figure out or find out how can I convert units to milliliters. And what's going to help me do that is my IV solution, because my IV solution is it's milliliters and there's units. So they're connected. They're in the same IV bag. I'm getting rid of units and I'm exchanging it for milliliters. So then I just plug in the numbers that go with these. So 500 goes with the milliliters, 20,000 goes with the units. Before I do any math, you will see that my units are canceled out and I'm left with milliliters per hour. So all I'm going to do then is take my calculator out. I can open it up on my phone. I'm going to take 8,000, multiply by 500, and I'm going to get 4 million. I'm going to divide by 20,000. And then I'm going to get a final answer of 200 milliliters per hour. Seems like a reasonable amount of that you would program into an infusion pump. So again, all I'm doing here is converting units per hour to milliliters per hour, and you're just manipulating the available IV bag as your available drug. So instead of it being like, 10 milligrams per milliliter or 125 milliliters per teaspoon or whatever, or 125 milligrams per teaspoon or whatever it happens to be, it's just using the IV bag as that source information. And then doing this and practicing this is exactly what you do when you're doing the heparin protocol. You're just converting units per hour to milliliters per hour for your final answer. Now, sometimes it'll ask you a similar type of question, but it'll tell you something like, it's in milliliters per hour, but they want to know units per hour. So the way you would do that is, let's say we're using the same information, but in this instance, we want to go from, let's say it's, let's say it's 500 milliliters per hour. And I want to go to units per hour. So this is like just a separate scenario. Okay. What I'm going to do is I would take, again, the 500 milliliters per hour, which is my starting infusion rate. And then what in this instance, I'm trying to get rid of milliliters in exchange for units. So I'm going to use the same information from my IV. And notice that actually ended up canceling out. So it wasn't intentional, but you get the process is still the same. And so this would just be 20,000 units per hour. Now, ideally, you'd want it to not be or not cancel out like that. But I'm just trying to show you, like, if you get asked a question, and I think I usually see this more like ATI being asked, not necessarily on your actual dosage calc test. But if you get a question like this, just know that if you're going from units per hour to milliliters per hour, you got to use your IV bag and then kind of manipulate milliliters and units. And then same thing goes if I want to go in the reverse direction. That's what's nice about dimensional analysis is once you realize that you can kind of organize the data as you see fit to solve your equations, that's how these things are solved. So if you're good on that, great. If you need some practice on that, that's good. Yeah, so there, at least not to my knowledge, there is no abbreviation for units. So good question. Yeah, you don't want to abbreviate it U because U kind of looks very similar to like the abbreviation for micro, like is that Greek letter U? So good question. I would highly recommend not doing the desired or the ordered over have method with anything dealing with flow rates, because it can get very, very easily, you could put numbers in the wrong place by doing that. But saying that, as long as you remember to do, like for this one, like this, the first setup that I put up here, as long as you did 8,000 divided by 20,000 times 500 and you were consistent with that, it will work, because it's basically the same thing I've written on here. But just make sure you don't mess up what goes where. What often happens when people do ordered over available or desired over have, um, like with the flow rate type questions, you are quick to make mistakes with where the units and the milliliters go, meaning that a lot of times students will write 8,000 divided by 500 times 20,000, and you're gonna get some ridiculous number, and your units and everything will all be wrong. And so, but if you can consistently do 8,000 divided by 20,000 times 500 to go from units per hour to milliliters per hour, then you'll be fine. Just pay attention to your quantity and your units, like where those things go, and then you should be fine. Let me show you what I mean by that. So for number 23, I'll do ordered over have. Now, I always say, like, me personally, that's what I'm doing when I'm doing these things, like setting them up in my head, because I can organize it because I've done these for way too long, okay, for many years. And so I know how to kind of organize the data in my head, and a lot of times I just plug it into my calculator just to make sure that I got the numbers right. But if you're not at that same level of comfort, then things can get a little bit challenging. I will say, if you are doing ordered or available, I'm going to recommend that you do it a little bit differently than how I've been showing the previous thing. I would say do something like this. I would take your starting point of your 250 milliliters, because you know you're looking for milliliters per hour, 250 milliliters. That way you don't mess up what goes where. Okay. And then I would divide by your 10 units. Let's just double check here before I make a mistake. Oh yeah. Divide by your 10 units and then multiply by your 2 units per hour. And that will give you the correct setup as far as doing that if you're going to do ordered over available. You just want to make sure that the units are opposite one another, and that the milliliters is in the numerator position or the top, and that your hour is in the denominator position in the bottom. So if you're going to do ordered over available or desired over have, this is how it would look like. Me personally, I just like to keep things simple as far as like when I'm explaining it. And so if you prefer this way as well, and there's no like one right way, I just want to make sure you're not putting the numbers in the wrong place. Okay. So as long as the 2 and the 250 are on the top and the 10 is on the bottom, you've done it correctly. And so what I will tell you is that if you try a couple of these, you find a couple of the practice problems, and you see that you might be, if you're missing them or making incorrect, incorrect numbering or getting the wrong answer, that's what I'm trying to say, then just make, we can have a conversation about how to kind of remedy that. So in this scenario, 2 times 250 is 500 divided by 10, and you're going to get an answer of 50 milliliters per hour. All right. See if we have, what else we got here. Okay. So those are the couple infusion rate questions. So I'm going to go ahead and get into the heparin question, and we can always come back to those. I just want to make sure that I tackle these, especially this one, since it's kind of new. So in the original version of this, so you'll see that I kind of blacked this all out. So if I remove the blacking there, the reason I crossed out a lot of these things is because you're going to see this on your test, and some of this is my fault because I didn't know any better. But basically, this is what the heparin protocol looks like. So if you Google heparin protocol, this is what you'll see. You'll see all this information, and the information that I've crossed out, and now that I'm going to black out, is just information you do not need to know. Okay, so we can eliminate it from the decisions that need to be made when you're doing your calculations. Okay, so that's why I've written it this way. So imagine this is just like, it's like, 1 liter is 1,000 milliliters. That's what this is, basically just stating all of your information. If I were to rewrite all this, I would give you the patient's weight, I'd give you the available heparin, and then I would give you the information that I want you to calculate. But I think the damage has been done, and so you're going to just see this big monstrosity. But once I show you how to answer it, you'll be able to navigate it a little bit better. And then I've also worked through this a couple different times over the years, so you can always look at it on YouTube to see the variations of that. So the heparin protocol is pretty standard, meaning you're always going to see heparin 25,000 units, 250 milliliters, half normal saline, and you're going to see a bolus dose of 1,000 units per milliliter. So those things are standard. The other thing that's standard is the order information. So bolus with 80 units per kilogram, and then start a drip at 18 units per kilogram per hour. Now, a lot of times you're thinking, when you see that word drip, you're thinking drop rate, but technically it just means that it's trickling out at a slow pace, but you're still calculating a flow rate in milliliters per hour. So like you're going to get answers that are like, 10 milliliters per hour. And if you think about how slow that must be coming out, it's going to be coming out in a drip-like fashion. And then over an hour, only 10 milliliters will be administered, which in the context of heparin makes sense. You don't need a lot of heparin. You need the appropriate titrated dose, so that way you don't cause your patient to either excessively bleed or excessively clot if they're getting, too much excessive bleeding, too little excessive clotting. All right. Then there's some additional information here, and this will make sense when we look at the questions that are being asked. But basically is after they've gone through some portion of heparin therapy, we reevaluate their clotting time, and then we make a decision on what to do next. So let's say like it's, their clotting is still within that 36 to 44 second range. Then we're going to rebolus, and then we're going to increase the rate of heparin infusion. So it's how we kind of, or how we use the protocol to answer the questions. So when you take your test, you're going to get 2 questions. The 2 questions count as 1 point. Okay. So like, it'll be like question 24, part A, part B. If you get them both right, you get a full point. If you get one right, one wrong, you miss the point. If you miss both questions, you've only missed 1 point. So there's some, good feeling as far as, hey, I have 2 opportunities here to get it right, but the max number of points I'm going to lose out on is 1. But once you go through this review, once you practice a few times, you won't miss this at all, because the hard part is just knowing how to navigate this question. So it starts off with telling you the protocol to bolus the patient with heparin 80 units per kilogram body weight, and to start a drip at 18 units per kilogram per hour. And then it tells you right here in step 10 of the protocol, it's the same thing. Bolus with 80 units per kilogram, start a drip at 18 units per kilogram per hour. Just tells you what to do, okay? Then it tells you that the patient's weight is 220 pounds. and it tells you to answer the questions below the protocol. So this whole thing that I've highlighted in yellow is what we consider the heparin protocol. And what I should have done is boxed it in, made it look more obvious, like it's a protocol, as opposed to answering like what's the CBC and what are the neurochecks. That's not part of math, so we don't need to worry about that. We just need to know some things. So you're going to answer 2 questions, but I gave you a variety of questions. I actually gave you 4 questions to kind of practice. So you'll see A, B, C, but you'll get like A and B, or you'll get C1, C2, meaning that you'll just get a variety of questions here. So really the only thing that I can change in this question is the patient's weight. Other than that, the information stays about the same. There's no change in the bolus. There's no change in the infusion rate. There's no change in the availables, at least in the standard heparin protocol. There are other varieties, but once I show you how to look for it, it won't be a challenge. So the first thing it tells you to do is calculate a bolus, and it says to look for milliliters. Then it tells you to calculate an infusion rate in milliliters per hour. Again, don't get hung up on this word drip. They're not asking for drop rate. So what I'm going to do is, to make this question a little bit different than what is on previous tests, is I'm actually going to change the patient's weight. So let's say this patient is, let's say 156. Okay. So just randomly making up a patient's weight. So step 1, in order to solve heparin protocol, because it tells you to bolus with 80 units per kilogram. Anytime you see something per kilogram, you know you have to take the patient's weight into, factor the patient's weight into the equation. So the patient's weight is 156 pounds. And what I'm going to do is I'm going to convert that to kilograms. And it even tells you that here in the protocol. So I'm going to convert the patient's weight from pounds to kilograms. So I'm going to take that 156 divided by 2.2. And I'm going to get 70.9090. Just keeps repeating. So I'm just going to say 70.9 kilograms. Okay. We're going to use, as long as we're following and talking about the same patient, we're always going to use that 70.9 kilograms, whether we're calculating a bolus or calculating an infusion. Okay. So I'm going to come down to where it says calculate the number of ml to administer for the bolus. And thankfully, I can see the bolus information listed here where it says 80 units per kilogram. So I'm going to take the patient's weight in kilograms. I'm going to multiply by the bolus. When I do that, I'm going to get 70.9 times 80, and I'm going to get 5,672. That's units. Now, if all we wanted was units, we'd be done. But it specifically says the number of milliliters to administer for the bolus. So I have to know how to convert units to milliliters. And it's very similar to what we did in the previous problems where we were converting units per hour to milliliters per hour. But here we're not talking about a rate. We're just talking about a quantity, because a bolus is a one-time dose. So I have to look at the protocol. And step 2 of the protocol gives me my available. Okay. I have available 25,000 units and 250 milliliters half normal saline. And I also have a bolus dose of 1,000 units per milliliter. Those are 2 different variables within the context of the heparin protocol. One's the bolus dose. We get them started. and then we get them on an IV drop or drip for administering heparin over a period of time. So 1,000 units per milliliter. That is my available syringe. And so what I'm going to do is I'm going to convert. Now, this is where you can do ordered over available. Okay. So if you want to do order over available here after you convert or get rid of the kilograms and apply the patient's weight, then you can do ordered or available. I'm just going to continue to show it to you in this context, dimensional analysis. So there's 1,000 units per milliliter. And then my answer, and then I'm eliminating units. I'm left with milliliters, which is exactly what I'm looking for. And I'm going to get 5.672 milliliters. And we're just going to round that to the nearest tenth. So 5.7. Any questions on how I got to the bolus dose strength? Okay. The next part is, and like I said, when you do the heparin protocol, you're going to calculate a bolus and you're going to calculate a flow rate. Okay. So we just did the bolus. The short way of thinking about this is take the patient's weight in kilograms, multiply by 80, divide by 1,000, and that'll be your answer every single time. Okay. Or at least for the standard protocol. Patient's weight in kilograms times 80 divided by 1,000, and you'll have your answer, or at least the milliliters that you need for that answer. Just remember to round to the nearest tenth. For the heparin drip, now we're going to use different data to calculate the flow rate. So when we go back to our protocol, we already did the bolus. Then it tells us to start a drip at 18 units per kilogram per hour. So we still have that kilograms in there that we need to get rid of, but we're just going to use that same 70.9 kilograms. Okay. And then instead of multiplying by 80, you're going to multiply by 18. Then we want to use our IV because anytime we're dealing with a flow rate, we need two pieces of information. We need units per milliliter, and we don't want to use the bolus dose because that's for bolus only. We want to use what we have available to us. So basically all we're trying to do is, what they're asking you to do is, what would I set the infusion pump to? Okay. Would I, set it at a higher number or lower number based off of the information that's here? And that's why we're doing all these calculations. And then the trick to all this is just knowing which pieces of information to utilize. And now hopefully you'll start to see it, especially as we do a couple of these. So same patient, same weight, 70.9 kilograms. Now I'm going to multiply by that 18 units per kilogram per hour. We're getting rid of kilograms. So 70.9 times 18. And I'm going to get 1,276.2. 1,276.2. And this is units per hour. Now, sometimes I'll write it like that. Sometimes it makes more sense to write it like units over an hour. So maybe what I'll do is it's okay. I'm not gonna worry about that. All right. So I might just for keeping things simple for myself, say units per hour. Actually, here. This looks ugly. Sorry. 1276.2 units per hour. Again, sometimes I write this just to kind of keep things simple, and that way you can kind of see where I'm multiplying and dividing. Again, you can use ordered over available for this, or desired over have, but I would caution you because you have to know where things go. Okay. It's already tricky enough. So I'm going to show you the way that I would do this, and then I'll tell you the simplistic way. But once you get to units per hour, you're going to do what we did earlier, and we're going to convert units per hour to milliliters per hour. And we're going to do that by getting rid of units and multiplying by milliliters. So as long as you put the units, like whatever you get after you multiply by the patient's weight, and if you divide by the units, multiply by the milliliters, then you're setting up your desired or your ordered over have available, or what you're looking for, sorry. So milliliters and units. We know we're not using the 1/1000. Why? Because that was for the bolus. So you only use the bolus with the bolus information. So what's our other thing? We have 25,000 units, 250 milliliters, half normal saline. So those are the numbers we're going to use. 25,000, 250. So a different scenario. Okay. Different values. Again, before I do any kind of math, I can see that I'm going to get milliliters per hour, which is what it asks me to solve for, calculate for. So 1276.2 times 250 divided by 25,000 will give me 12.762 milliliters per hour. Now, this is where things get a little bit weird, because I'm going to tell you round to the nearest tenth. I would definitely get some clarification from your instructor if they want you to round that to the nearest whole milliliter per hour. But from what I understand, you can still give somebody a decimal milliliter per hour. It's just a smaller unit. You just can't give somebody a decimal drop, right? So if it's 29.9 drops per minute, it's 30 drops. You just round to the nearest whole number. But for this one, you should be able to round that to 12.8 milliliters per hour. The shorthand way of solving the infusion rate, at least for the initial infusion, is take the patient's weight in kilograms, multiply by 18, and then divide by 100, because 250 over 25,000 is 100. And that's only if you're doing the standard protocol, as it's listed here with the 250 milliliters and the 25,000 units. If its numbers are different, which it shouldn't be, then you would use those numbers and ignore what I'm saying about the 1/100 thing there. All right. So we've gone through the bolus and we've gone through the infusion. So that's pretty much probably what you're going to see. And the only thing that's really going to change is the patient's weight. So my challenge for you is go through this protocol, use your weight, use, your significant other's weight, use child's weight, parents' weight, use another weight, start in pounds, convert it to kilograms, and then see if you can get a bolus in milliliters and an initial infusion in milliliters, and you'll have lots of practice with that. And then if you want me to check your answers, just email it to me and just say, hey, I did 135 pounds and I got this milliliter for the bolus and I got this milliliter per hour for the infusion. Is those correct? And I will give you feedback because it's pretty straightforward on how to answer those. Because like I said, the only thing that really changes is the patient's weight. Occasionally, and you'll probably see this more in fourth semester, my assumption is they might ask you like follow-up data and ask you like a follow-up question, and I'll say, okay, after 6 hours, they retest the patient. They test the patient's APTT, their clotting time, and they find that it's whatever the value is, 43 seconds, whatever happens to be. Then it says, what do you do with that information? So you have to look at the it's in the box here is what happens after the 40 seconds. Okay. Or I'm sorry, after the 6 hours. So let's say you have an APTT that's less than 35 seconds. They're clotting too quickly. Okay. We're going to increase the bolus, or I'm sorry, we're going to rebolus. So same amount, 80 units per kilogram. And then we're going to increase the infusion rate. So they've already been bolused 6 hours prior. They were already on 18 units per kilogram per hour. After 6 hours, if their APT is still too quick, less than 35 seconds, then we're going to rebolus again. So the same number. So you wouldn't have to do any different calculations. It would just be another 5.7 milliliters. And then we would actually increase the rate. So we would go from 18 to 22. Okay, but that's only if the APTT is less than 35 seconds. I gave you 43 seconds, so you can see you would rebolus with 40, increase the rate by 2. If it's between 45 and 75, that's the sweet spot. That's exactly where you want to be. So you would just continue as needed. If it's 76 to 90, then you're overdoing it. So you can go ahead and start to titrate it down. And then if it's greater than 90, then you would want to hold the heparin and then again decrease the units again by 3. So there's different things. You're just following what the protocol tells you to do in those scenarios. But I will say, at least any tests that I've ever written or gave examples for, we usually follow the step 12 scenario because it gives you 2 things to do: a new bolus and a new infusion rate. So let's work through that. So we still have the same patient. The patient still weighs the same. They still weigh 70.9 kilograms. Okay. If I can get this to right for me. That was weird. All right, so 70.9 kilograms. Now, the new milliliter bolus tells me to rebolus with 40 units per kilogram. So I'm going to multiply by the 40 units per kilogram. And then I'm going to get 70.9 times 40 for 2,836 units. We don't want units, we want milliliters. Now I have this memorized, so just as a reminder, I'm using the bolus dose strength. Why? Because I'm calculating for bolus. So it was 1,000 units per milliliter. And again, I got that from the protocol. It's the only thing you know, and that's what's given to you. Okay. And so I'm going to get an answer of 2.836 milliliters, and I'm going to round that to 2.8 milliliters, which should be half of my, what it says, 5.7 here. So 2.8 would be probably a better answer. So again, all I'm doing is following the protocol. Instead of using the 80 units per kilogram, I'm using the 40 units per kilogram. For the new infusion rate in milliliters per hour, it tells me to increase the rate by 2 units per kilogram per hour. Our initial was 18, so I'm going to raise it up by 2 to 20. And so I'm going to take my patient's weight, multiply now by 20 units per kilogram per hour. So 70.9 times 20 will give me 1,418. And that's units per hour. I don't want units per hour. I want milliliters per hour. So again, I'm going to use my information that's not the bolus. That's why I'm choosing to use the 25,000 units and 250 ml, because that is what is given to me. And it's not the bolus. Okay. It's what we have in the infusion rate. And they're already on the infusion rate. They're already on the IV. All we're doing is changing the number that is programmed in there. I'm going to get 14.18 mil per hour, and I'm going to round that to 14.2 mil per hour. A common mistake with these, and I will say that I've also fallen for this common mistake, is the I have the scenario where I have taken that, increased the units by 2, and I said, oh, okay, so if I'm increasing by 2, I'll go from 12.8 to 14.8. If you did that, technically you'd be real close to your answer because it's a minimal thing, but that is not the right way to do it. So if they're looking for it down to the 10th and you wrote as an answer 14.8 milliliters, you'll get that wrong. So don't just add 2 to your final answer. You have to add the 2 to the 18 units per kilogram per hour and run through your calculation again. So I gave you 2 scenarios. Most likely you're going to see this scenario here. Calculate the number of milliliters for the initial bolus, calculate the initial infusion rate, and that's all you're going to most likely have to worry about. I don't anticipate that you'll have to do what I just worked through, but it's extra questions. If you can do it, it's an extra challenge, and I think it'll help you out in the long run. I have some other questions down here where you can kind of follow along, but I've kind of truncated the information. And so what I'm going to do is, just to kind of make this more of a challenge, I'm just going to change some of the names here or some of the values for you, and then you can practice these at your leisure. So what do? We did 156. So that's 165. Let's do 132. And then that way you have two more scenarios that you can work through. And like I said, if you go through it and you want to confirm your answers, just email me and I'll make sure you have it. So, all right, well, that's the heparin protocol. And then some of the flow rate type questions. Are there any other questions you have going into, we have the last 10 minutes of this review here. I know it takes a while to go through these heparin protocols.
Do you happen to know if we will have another dose calc for 230 once we get there?
You will not have a separate 230 test, other than you'll have a pediatric dosage calc test, but it's not the same type of test like this. It'll be done during your session of doing it. And then I believe I don't know about, like, you know how this test, you have to pass it in order to continue with 220.
Right.
But both 220, 230 students take the same test in the first week of classes.
Okay.
And then 230 also has a pediatric portion, but it's not till, like, the end of the pediatric unit.
Gotcha.
And I already put together reviews of at least the material that I had. So if you get to that point and you need additional help, just reach out to me and I'll make sure to help you out.
Thank you very much.
You're welcome. All right, let me go back up to 15. Let me make sure it's the same number because I know I changed my numbers on here. Okay, yeah. So when you're doing this, if it asks you first and foremost, just make sure you write your answers legibly next to the thing because it tells you to mark it with 2 arrows. I'm going to show you how I would mark it, and then you can just get some clarification from your lab instructor or whomever's teaching the thing. So first of all, you always want to make sure you choose the correct syringe. Okay. Um, and then when you're marking this, you want to look at a couple things. So it says your patients receive 10 units regular insulin and 40 units U100 NPH insulin. You want to know this, you want to mark the solution and amount to be drawn up first. Okay, so I always make this note and I'll say 10 units regular first. So make sure I would just write that down if they ask you this question. And then your correct total medication is just adding those 2 units together, right? So 50 units total. Now, where this gets a little bit hairy and weird is you're drawing up the 10 units first, and then you're drawing up the 40 units in a syringe. It's all going to mix together. So what they're asking you to do is mark this as if it were a hypothetical and the liquids were still like separated, and they don't do that. But you always know that your total is here, right? It's at that 50 mark. So that's your total. Okay, so total at 50 units. Your regular insulin is actually going to be between these 2 marks here. This is your regular, and then here is where your NPH is located. So if I'm marking my syringe and I want to make sure I'm indicating everything, just make sure you denote that your regular is here in these 10 units. It's not really, okay? Just so I want you to know we're all on the same page. If you're sitting there going like, well, no, it's not. I agree with you. It's not, because it all gets mixed together. But in order to correctly label this, if they're still asking this question, is you want to make sure you indicate that the regular is closest to the plunger side of the syringe, and the second thing you pulled up is closer to the needle side. In reality, that's not how that works. But in a hypothetical vacuum environment where the liquids don't mix, then your 10 units of regular insulin is right up against the 50, and then the 40 units is the NPH. Again, I don't make those rules. I'm just letting you know that that's how they want you to mark the syringe. Okay. And then yeah, so there should be, Kim, there should be one heparin protocol question that will have 2 parts to it. One heparin protocol question, part A, calculate the bolus, part B, calculate the infusion rate. Good question. All right, and then marking the cup. Typically you're just gonna like, so let's say my answer is 15 milliliters. You can just make sure you indicate like drawing a line, circling the thing. Just make a line across. There's a couple different ways. I would just say, please confirm with your instructor how they want you to answer that. I think they just want to make sure you don't like write 15 milliliters and then mark 25. So it's probably not super strict. I also don't think you need to fill in the cup or anything like that. I think you just need to clearly mark what you would fill it up to. Good questions. You're welcome. All right. Any other questions? Oh, we got 5 more minutes, and then if you're good, then we'll go ahead and call it a day. And then, like I said, I'll upload this either tonight or tomorrow. And then I'll be back this afternoon doing another review session if you have more questions. And if you can't jump on any of the other review sessions, just email me and I will make sure to answer your question. Yep. All right. Yeah, you're welcome. Yeah, so when it comes to rounding milliliters, yes, follow your rounding rules, meaning you would round to the nearest tenth. The exceptions to that are if your instructor tells you otherwise. But so far it's been milliliters, you would round to the nearest tenth because you can administer, like, look at your, like, if you go to a syringe or even here, right? This is 1.5 milliliters, so 1.5 milliliters. You can give somebody a tenth of a milliliter, a hundredth of a milliliter, a thousandth of a milliliter. You can break it down as small as the syringe will allow you to do it. The only gray area that I have with all this is when you do your flow rates, does that same calculation apply? From what I understand, yes. It's just a matter of if your infusion pump can actually, if you can actually program decimals into it. You may not be able to in reality, which is why I always encourage students to make sure that they ask their instructors, hey, if I'm calculating a flow rate and I get something like 124.5, is that my answer, or do I round that up to 125 milliliters per hour? So if you do hear any differently than what I'm telling you, please relay that information back to me, including who said it. That way I can follow up with them and ask the appropriate questions. So, all right. I think that's a good place to stop. I'll have these uploaded for you this afternoon. And then like I said, I'll be back on this afternoon as well. And I'll have this uploaded either on YouTube this afternoon or tomorrow. And then we'll go from there. All right. Yep. You're welcome.